Hi, recently you might have seen a video of Dr. Abby Phillips attempting to debate another PG scholar, Dr. Vasundhara, on the topic is Ayurveda a pseudoscience? Now, let's pause and watch the video closely because for me, the talk was more like a deliberate attempt to corner a PG student, take advantage of her limited experience rather than engaging in a fair debate with medical experts in the field. This doctor brings in students, newbies, or sometimes practitioners, but makes sure that they don't have strong communication skills, which is essential to drive a point in high level debates like this, because then it makes it easier for him to steer his narrative. But before I start this video, I have to mention that I have huge respect for all medical practitioners and I have great friends who practice modern medicine and I learn a lot from them. So this video is not intended for any ad hominem attacks. Rather, I would like to analyze, dismantle some of this man's propaganda, or should I say politicized narrative against Ayurveda, which seemingly is building around himself and his followers. Now, first of all, he claims that Ayurveda is not testable, falsifiable, replicable, or falsifiable like other sciences, and that is why one of the reasons, which is outrageous lie. Now we have zillions of RCTs or randomized controlled trials, and even perhaps meta-analysis evaluating Ayurvedic single drugs or sometimes some formulations and interventions. Now, if the moment you subject a therapy to an RCT and place it in a scientific framework, it can succeed or fail based on measurable outcomes, and that is in itself is falsifiability. For example, an RCT, a randomized crossover clinical trial, to mention as an example, evaluating the effectiveness of ginger in reducing pain following periodontal surgery. In this RCT, patients were given ginger. Now, ginger is a very known anti-inflammatory drug in Ayurveda, so it was given against ibuprofen under controlled conditions, where pain was measured, outcomes were compared, and in that outcome, in that RCT, if ginger showed no benefit, the hypothesis failed. And if it succeeded, the hypothesis is supported. So either way, the claim is testable and it's open to refutation. So how can one claim Ayurveda is not falsifiable in this particular era, when interventions are tested and every day, in every second, every possible situation, the exact same way the current methodological frameworks used in biomedical research works. So only thing is, I mentioned earlier, certain formulations which have multiple drugs require novel framework for testing this particular agent. We're still working on that. So that is first. Second misinformation is that the idea that evidence-based practice today is totally made up of only high-quality randomized controlled trials or meta-analysis. That's another big lie. Evidence-based practice is not about restricting ourselves to only the so-called high-level evidence or RCTs or gold standard. These days, it is getting converted into living guidelines, updated as per patient requirements. In the current scenario, in the real-world scenario, clinical situations, available high-quality RCTs can be contradictory, whatever is available. So that means the evidence is insufficient, or it is unavailable. Medicine does not collapse. Doctors don't stop practicing. Patients will still need treatment. So, for example, in scenarios especially in emergency medicine, clinicians rely on something called implicit consensus immediately, to ensure care and safety and uniform patient care is given, which can be based on observational studies, case reports, or case series. In other words, even just suggestions or reconciled expert opinion, because it has to be available. Now, third thing is he says that Ayurveda whether Ayurveda has meta-analysis. If it has, it has to be converted into consensus guidelines, and without that, it lacks validity. He says meta-analysis has to be converted into guidelines.
This particular evidence called as a systemic review and meta-analysis of
No, yeah.
Ayurvedic herbal preparations for hypercholesterolemia by Goyal in the complementary therapies in medicine, which is PubMed Index, and it has the sample size n is
I
equal to
asked
1000.
about consensus guidelines, not the paper. Because if
No,
it is a meta-analysis, it has to be in the consensus guidelines.
no, there is no such rule that if
Who decided that for him? Because we can have meta-analysis. Meta-analysis exists, but have not been endorsed into formal guidelines. This is one scenario. For example, yoga is endorsed as conditional recommendations for knee osteoarthritis. They have meta-analysis. Now we have meta-analysis for yoga in IBS, but has not been endorsed into IBS guidelines. So because guideline formation does not depend on this high quality evidence alone, it depends on multiple factors: applicability, patient population, feasibility, whether it is clinically relevant to be applied, not just the existence of this meta-analysis. And in fact, opposite to this can also happen. Sometimes we don't have robust guidelines, but it can be accommodated into as a clinical guideline recommendation. For instance, we have recommendations for using corticosteroids in severe allergic reactions, but its benefit is not strongly proven through high quality trials. In fact, maybe we can get trials which oppose that recommendation, but still it continues to be recommended in guidelines. So presenting this as a rigid rule or as an assessment tool to measure a science or and its validity is also weird. I'll give you another example. For instance, take a condition called recurrent corneal erosions. Here we have millions of people getting affected by it, recurrent corneal erosions. We don't have any robust evidence or standardized protocol or the so-called consensus guidelines. But practitioners do treat this condition with evidence, whatever is available in hand at that particular point of time. So in reality, clinical practice is not just based on high quality RCTs alone. It is a layered system where you bring in clinical experience, you bring in the reasoning that happens and the best available evidence to support that framework and its applicability. All this work together. Now, in this debate, if you see, he makes a sweeping universal claim that modern medicine is entirely evidence-based in the sense of relying only on high quality RCTs, and modern medicine uses only meta-analysis for setting guidelines. He makes this many times, you can see throughout, and Dr. Vasundhara is trying to debate against it as his major premise. If that major premise is used to label Ayurveda as pseudoscience for not meeting this standard, if someone does that, it is a problem in a debate, because even a single counter example is enough to challenge that universal claim that he makes, because that's falsifiability by Karl Popper. I've given you multiple examples here. So the argument that Ayurveda is pseudoscience because it does not have meta-analysis that is converted into another medical system's guidelines simply looks so weird and stupid. So for those of you who have asked me whether I am willing to debate with this doctor, the answer has been yes. But the problem is, there's an issue. Whenever simple practitioners like us, we're not even experts, when we raise counter questions on any platform, he tends to block us like this, or he will throw in comments. He will flood the discussion with loaded with lot of insults like this. So with this I close. Thanks for watching. I'm Dr. Reshma with you.